Welcome back. It's Wellness Wednesday, a special segment to help you live healthier.
And health experts are sounding the alarm about a spike in hepatitis cases in children. Joining us to talk all about it, to explain it to parents what you need to know about this disease, OU Health's Dr. Donna Tyungu. Thanks for being here with us, doctor. First of all, let's start with this, because we were just talking about this, and I was like, is this connected to hepatitis A, hepatitis? No, this is an unknown hepatitis. Tell us a little bit about it and what you're seeing.
Yeah, sure. So when children present with a hepatitis, they usually have like a jaundice, they might have some abdominal pain, but this hepatitis so far, it is unknown, but what we do know is that it's not linked to hepatitis A or hepatitis B or the other typical hepatitis that we would see.
I just think about parents watching. It's just something else to kind of be mindful or worried about, you know, when it comes to our kids. So how concerning should parents be about that? And what do they need to do if they start seeing some of those symptoms?
So I can totally relate. I have a 2-year-old.
Oh, yeah.
So when I saw the cases first time, and
oh my gosh,
it was March 2022 coming out of the UK, I was like, you gotta be kidding me, like not another thing. So at this point, I'm not overly concerned. Okay. It's pretty rare. Worldwide, we know that there have been 650 cases so far. I say rare, but if your child were to develop this, most of the cases require hospitalization, and about 10% of them actually require a liver transplant. But, I mean, of all of our 18 million under 5-year-olds in the United States, we've only had 216 cases in the United States.
Okay. So here's what I'm wondering. I have a 3-year-old. The other day I saw him, no joke, I turned around, he was licking the sidewalk. Okay, it's part of it, right? So I'm wondering, what is it? Do you guys know yet how children are able to get this, or are there ways parents could prevent this?
Yeah, so great question. The cause is unknown. There's a lot of questions about this. We think it might be linked to an adenovirus, which is a respiratory virus that you get from, you know, not washing your hands after talking to people who might be sick. But we don't know for sure. Typically, if an adenovirus were to lead to a hepatitis, you would see viral inclusions in the liver, and the biopsies that we've seen from these children who are sick don't have that. So it's still a question, and so there's questions about is there a link potentially between a prior COVID infection and adenovirus triggers? We just don't have those answers yet.
So, like, yeah, I mean, like, if a child has had COVID, what about if a child's been vaccinated? I mean, is there any connection with either having the disease or getting vaccinated? Because it seems like hearing more about it since COVID, you know, is there a correlation?
So that's a great question. So there might be a link to having had an active COVID infection. 20% of the cases have tested positive for COVID. They're still investigating prior COVID infection, but vaccination is not likely at all, because the majority of these kids are less than 5 years of age. And obviously they don't have access to vaccines. So.
Well, it's certainly good, doctor, to hear that it is rare. I know you guys are still learning a lot about it. If folks wanted more information, is there somewhere they could find out more about this particular hepatitis?
Yeah, sure. I think I would point people to the CDC page. They are, if you type in CDC pediatric hepatitis into Google, they are updating weekly on their on that page about updates across the country, if we are having new cases and looking into this.
I was going to ask you, is his boy going to be okay licking the sidewalk?
I try to prevent as much as I can.
I study parasites. Yeah. He's going to be fine.
We'll do what we can. Dr. Tyungu, thanks so much.
Thank you.
Good information. We really appreciate it.
All right, thanks.